Madam President, since 1996, we have recognized March 10 as Abortion Providers Appreciation Day. I rise today, therefore, in gratitude for the doctors and healthcare professionals who bravely continue to provide necessary care despite attacks on reproductive rights and abortion providers. To express gratitude for the hard work and commitment of abortion providers and their staff across the country, and in remembrance for those providers tragically lost to extreme anti-abortion violence, providers like Dr. David Gunn. On this day, 32 years ago, Dr. Gunn, a dedicated medical professional, was murdered while walking into the clinic where he worked. Dr. Gunn was targeted by an anti-abortion extremist for simply doing his job, providing crucial, life-saving care to his patients. Tragically, this kind of violence against abortion providers, patients, and clinics has only increased over the years since his murder, and even before. Since the 1970s, there have been at least 11 murders, 42 bombings, 531 assaults, and thousands of other criminal incidents against innocent people, doctors, patients, and staff, simply providing or receiving necessary reproductive care. Congress enacted the Freedom of Access to Clinic Entrances Act in 1994, more than 30 years ago, to prevent this kind of violence at our reproductive health care centers and clinics, and the Justice Department prosecuted people who violated this law. Rather than supporting this law, within days of being sworn in office as President Trump pardoned 23 anti-abortion extremists incarcerated for violating the law. Moreover, his Department of Justice announced they would stop prosecuting most cases under this law. As the Trump administration is taking steps to dismantle safe, licensed clinics that provide quality, life-saving reproductive care, Republicans are also working to fund unregulated anti-abortion centers or crisis pregnancy centers nationwide. Earlier this year, Missouri Republicans introduced a bill that would let their taxpayers take 100% deduction on state income taxes for donations to crisis pregnancy centers. Essentially, in Missouri, they want to redirect funding from critical state services to these so-called crisis pregnancy centers that spread dangerous misinformation while doing very little to actually help women seeking fact-based medical counseling. Republicans aren't trying to help women. They're attacking fundamental health care and emboldening violent anti-abortion extremists by not prosecuting violations short of murder, effectively eliminating any serious consequences for those who attack, threaten, or intimidate innocent people in reproductive health care spaces, patients and providers alike. Democrats, on the other hand, remain committed to protecting abortion access and protecting the professionals who provide it where legal. Today, on Abortion Provider Appreciation Day, we remember Dr. David Gunn and all those killed and targeted by senseless acts of anti-abortion violence. And we honor the bravery of abortion providers across our country. These providers, their staff, counselors, continue to provide essential care despite the threats they face. While Republicans work to ban abortion nationwide, we Democrats reaffirm our commitment to protecting and strengthening reproductive rights for all. To abortion providers in Hawaii and across the country, mahalo for your critical, courageous work. Madam President, I yield.